What's your snap judgment here?
Well, this is a win. I mean, the fact that it's saying that it would reduce the federal deficits by $337 billion is definitely something that this White House is going to be pushing for. Now, again, the fact that it would increase the number of people who are currently insured and then they would be now uninsured, that's a number that Democrats are going to pounce on as well. But without question, the fact that they're saying it would reduce the federal deficit is a takeaway for this White House. But whether or not they can head into 2018 and remove people from states that they quite frankly won in the last presidential election cycle, to have that directly impact them and have them without insurance, that's a political tightrope that they're going to have to walk.
Well, the Democrats just got some more ammunition as well, because the CBO says 14 million more will be uninsured in 2018 under the House Health Bill. In 2020, that increases to 21 million, and in 2026, that increases yet again to 24 million. Were these numbers in line, much bigger than expected than what had been whispered? I mean, Joe talked about a whisper number for the CBO scoring than people had estimated.
Well, I think in terms of the whispering, the fact that they're going to reduce the deficit is definitely going to catch some members of the House Freedom Caucus as well as some conservatives off guard. But I can also tell you that in terms of just how this will impact people, especially folks in states like Wisconsin, Michigan, Kentucky, Indiana, and all of these states that have really been impacted by the Affordable Care Act, who have gained access to health insurance because of the Affordable Care Act or Obamacare. That number of 14 million within the first couple of years, having them lose coverage, that is going to be immediately what Democrats pounce on. That puts a face on this issue. It also, of course, is going to really set a huge test for this administration to make a selling point, make a case that those people who lose coverage, there's really nothing more personal right now than health insurance coverage and how it impacts so many people. So this administration has to make the case that those people will be better off. And we saw this earlier today with White House Press Secretary Sean Spicer vowing that those people will not be worse off as a result of losing that coverage. That's where this fight is headed.
Kevin, so it's pretty clear how the two sides are going to handle this report. Democrats are going to point to the surging more than 20 million uninsured in the coming years. Republicans are going to point to the budgetary savings. Will the budgetary savings part be enough to get some of those Freedom Caucus members on board?
I think it might be, but I also think that when you look at the actual plan itself, and I don't want to play prediction here, but I would note that there are several taxes that are still included within House Speaker Paul Ryan's plan that has members of the House Freedom Caucus very upset, to say the least. Items like the Cadillac tax, items like Medicare expansion, which rattles some of these more ultra-conservative members. And so some of these taxes that are as a result becoming what Tea Partiers would say are institutionalized as a result of this plan, have them very uneasy. Now, on the flip side of that, other Republicans are incredibly uneasy, albeit for very different reasons. Because again, when you start talking about health insurance and people and constituents losing access to health insurance, and for as unpopular as Obamacare is amongst large swaths of the Republican base, there are large parts of Obamacare that are particularly popular. And heading into 2018, heading into the Midwest, heading into flyover country, as it's called, as Republicans have talked about, those folks, those constituents, those Americans losing access to coverage, that's a big problem. That's not just a big political headache. That has direct impacts on people's lives.